Well, hey there, Andrew Gorecki. This is video number 2 for July, talking about neck pain. And I've got this really neat app that I wanted to share with you. It's called Complete Anatomy, or Essential Anatomy, I think is the old name. And really, this is a really cool way for me to show the two most common reasons why someone or sources of neck pain. And you can see here that this is a skeleton, and I've got the cervical spine highlighted. And you can see that each one of these segments is a free-floating bone. It's a vertebrae. And if I highlight the entire spine, the entire cervical spine, you can see that this is all the cervical spine segments. And it's really important to note that there's two main causes of neck pain. One is what's called Fassett pain, and this is looking at the back of the spine, and you can see that each one of these bones moves, and it has a little joint right here called a facet joint on each side. There are these little disc-like flat sections that actually move, and you can see that, like for instance, as the head moves forward, this top vertebrae will slide up on this joint. This slides up. If I rotate the head to the left, you would see that this one slides down and this one slides up to get rotation to the left. Same thing with side bending. If I side bend to the left, this one comes down, this one goes up. So commonly when somebody has pressure on these sections of the spine called the facets, you can get facet-related pain. And that would be because of overloaded pressure on those joints right there. That typically is going to be just pain right in the center of the neck, maybe on one side, but there's going to be no pain that's traveling down the arm. Now, the second type of pain is when you get a nerve that's compressed, and this is a really cool visual here. If I hit the nerves, I can actually zoom in, and you can see, if I get the right angle here, you see how there's a little nerve that comes out of this hole? I can show you the hole right there. It's white, it has a little sheath. Well, that nerve comes out of each segment. So each one of these has a hole that a nerve comes out of. And that nerve root is coming right out of your spine. And there is a hole. And, you know, oftentimes when we're moving, if we move the spine, if this segment gets moved too far, it can actually close down that hole and cause pinching. Also, people can get disc herniations, disc bulges. But this is a really neat picture of the nerve coming out of the hole. And then that nerve, you can see if I zoom out, that nerve joins up with these other nerves right here. You can see that they come out and they join what's called the brachial plexus, which is a really big nerve network that goes down, which goes down the arm. You can see it right here. These become big nerves. They travel all the way down the arm into the hand. And so you can see that from the front here. Nice big nerves that go down the arm. So when those nerves get compressed, again, looking at the spine, there's the front, there's the nerves coming out. Each segment has a nerve coming out. And ultimately that's going to be, if that's compressed, you're going to get pain in the neck as well as traveling down the arm. You can see there's the nerve networks that go down the arm and all the way to the fingertips. So sometimes there's pain, numbness, and tingling. It can be caused by just too much motion occurring that's closing down the hole. It can be caused by disc issues. Also, another one for you people out there that are over the age of 55. I'm going to get out of this and go back to my my neck, cervical spine. We talked about this hole again. For people over the age of 50, we know that this hole starts to get smaller. It's called degenerative disc disease or stenosis. And so that is a natural aging process, but that puts us at a disadvantage because the hole diameter becomes smaller where the nerve comes out. The hole diameter is smaller. And so there are motions that you do every day, every time you move, that either makes the hole smaller or larger. And I'm going to take away these nerves again so we can see that. So here's the hole right here. I can do motions to make that hole bigger. So for example, if I bend my spine or my neck forward, it makes the hole very big and the nerve's happy. But if I go backwards into extension, it makes the hole smaller. So every day we're doing motions to make that hole bigger or smaller. And when you have motions that are occurring that too much to the end range that make the hole smaller, that's when you start to have trouble with that nerve being compressed. So if I extend too far backwards, if it's the right side, and if I lean to the right or bend to the right, that makes it smaller. And then, of course, if I turn away, so if I turn to the left, that makes the hole on the right side smaller. And so really the job of the physical therapist is to look at the body and say, okay, what are the motions that are occurring in the neck that are making that hole too small? And how do we not only reduce that from happening, reduce the hole from getting smaller, but also teach you ways to relieve nerve compression or facet compression. So this is just a quick description of some cool anatomy here. And in video 3, we're going to talk about really what are the areas in the body that make that hole get too small with movement. And we'll talk